One more question, and this is relating to housing. I mentioned that when it comes to our healthcare professionals, that you simply cannot attract them if you have substandard facilities, and you can't attract them if you have housing issues. In far too many places in Alaska, there is no place to rent, there is no place to buy, and so staffing quarters are an important thing. We provided $11.5 million for staffing quarters in the FY18 omnibus. Once again, we're working to make these good things happen, and I appreciate my colleague and teaming up with us. But with that was new authority to directly subsidize housing costs for medical personnel. So can you give me an update as to how the funds for these quarters have been allocated, whether they're going to help with some of the issues in the Great Plains, kind of where you are with that?
Thank you, Senator. Of the 11.5, we have looked across the agency at the areas of greatest need and have identified the Great Plains area, Navajo area, and the Alaska area as the locations with the greatest housing deficiency need currently. With the Navajo area, we had a site whose housing unit actually burned down, and so that's an acute need. So we've identified $3 million of that 11.5 to go to the Navajo area, another $3 million to the Great Plains area for their area of greatest need, and the Alaska allocation would be 5.5, and our thought is that would go to the Barrow region.
Yeah, there's some great needs there, and the costs are much higher in Alaska, and the one in the Navajo was an apartment building burned down, so that gives you, a general idea of well, not general, specific idea, excuse me, of where we're looking to put that $11.5 million. And thank you very much for providing that to us. Much needed.
Much needed. I think we would all acknowledge wholly inadequate in terms of being able to meet the needs, meet the costs. But again, that's an area where we will just continue to work with you on.